Today on Investigate TV, a fight for transparency. Whistleblower documents expose how the military handles medical mistakes.
They hold all the cards. They hold all the cards. And they're not being, and the DoD is not being held responsible.
Our team gets answers from a top military healthcare leader.
My heart breaks for patients who have had complications and unintended outcomes as the result of our care.
Plus, how a federal law can help you wipe away surprise medical bills.
My daughter had no choice when she was unconscious on the operating table who worked on her, and she shouldn't have to pay for an out-of-network doctor under those circumstances.
Investigate TV starts right now. Hello and welcome to Investigate TV. I'm Lee Zurich. Thousands of military families across the country are being shielded from critical information about the providers who handle their health care, even when those families believe mistakes in misconduct have caused injuries and deaths. But a whistleblower is helping reporter Josie Sturman pull back that curtain of secrecy.
There's a very significant problem with military medicine.
The DoD is fighting you from letting you know the truth. Why are they hiding it?
Shrouded in darkness.
We've got to make sure that they're held accountable.
After 2 years investigating military malpractice, battling the Defense Health Agency for records, and interviewing nearly 20 experts, patients, advocates, attorneys, and lawmakers, it was a package that arrived in the mail that is helping to crack a curtain of darkness, the one around negligent care at the hands of military doctors.
Nobody would know about it if it wasn't for whistleblowers within the Defense Department or investigative journalists.
A whistleblower sending our national investigative team documents typically kept confidential by federal law. We're seeing something families don't when their loved ones are killed or severely injured by military providers. It's paperwork that details the play-by-play that happens after a mishap in a military medical facility, as doctors lay bare problematic and tragic cases. After a death or serious injury, this is the first step the military typically uses internally to evaluate the potential for discipline or liability. It details whether doctors made errors in technique or judgment, delayed diagnosis, communicated ineffectively, even whether equipment was missing or failed to work. It asks two critical questions. Was the incident preventable? Did military providers meet the standard of care? But even when mistakes are made and acknowledged in black and white, what's said in this paperwork is withheld from military families, even if they sue or file a claim.
It's a chasm. It's a chasm of untruths, zero transparency.
Susie Way feels a void unlike any other. The kind only a mother who's buried a son can possibly understand. The hollow of heartbreak amplified by the aggravation of trying to figure out what killed him in the first place.
At what point did you know something is really wrong with Jordan here?
From day one. And I live with that guilt. I live with that guilt. That why didn't I get on a plane and do something about this? But he kept saying to me, Mom, I'm going to be okay. I trust them.
Jordan Way had no reason not to trust the medical staff at Bush Naval Hospital at 29 Palms in California. He was one of them. The 23-year-old Navy corpsman filled prescriptions as a pharmacy tech, but it was the one written for him after routine shoulder surgery that would turn out to be a poison pill.
He wound up in the emergency room several hours after he was released from the hospital. They didn't keep him. I didn't understand why they didn't keep him there.
Jordan, who by all accounts was otherwise fit and healthy, had surgery in December 2017. Records show he was discharged with oxycodone for pain. But just hours later, he was brought into the ER, disheveled, sobbing, and in very obvious distress, telling staff the medication was not working. His doctor increased his dose, added a muscle relaxer, and sent him home. Jordan's fellow Navy corpsman, keeping watch, dutifully doling out pills as prescribed by the doctor. The next day, still feeling no relief, he called his surgeon again, who increased to the maximum dose without further evaluation. Despite continued severe pain and more calls to the hospital, Jordan still wasn't seen in person. He died just 3 days later from opioid intoxication, records showing he took more than 80 oxycodone as directed.
He was opioid naive, and the dosing that the doctors were giving him, the other dosage, they weren't clearing his system. So he was having a buildup of toxins in a very short period of time.
But it would take years of fighting for his family to learn more about his death, requiring multiple Freedom of Information Act requests and congressional help to get Jordan's file.
Your mind just starts writing a story that you don't have any content, true content, to fill in the gap, so to speak. And then to try to get that information and to be told continually, we don't have to tell you anything.
The Ways never got that confidential form we showed you earlier. What they did get left a lot of questions. Jordan's file filled with black holes. The names of medical providers, even commanding officers, covered up. The curtain of transparency about who was involved in his care firmly closed. It's not the first time we've seen military officials playing doctors of defense.
What we reported, did it surprise you, shock you?
Of course it shocked me.
U.S. Senator Chuck Grassley reacting to the findings of our previous investigation into military malpractice. After filing numerous information requests over the last 2 years, we obtained data showing between 2018 and 2022, there were nearly 500 military medical provider reports to a confidential government data bank that tracks discipline, lawsuit settlements, and malpractice payouts. Hundreds of suspensions and disciplinary actions have been taken against military providers following misconduct and mistakes that have resulted in injuries and deaths. And nearly $1 billion in taxpayer money has been spent on malpractice claims filed against military providers in the last 15 years. The names of all of them are kept confidential.
In the civilian side, we know who those people are. Their names are public. And the public ought to be protected from people that don't deliver medical care the way that the profession dictates.
What do you think about that double standard, that the Defense Department, the DHA, keeps all this information secret and confidential?
Transparency brings accountability. You've heard me say that hundreds and hundreds of times.
Grassley, a longtime advocate for transparency and auditing, especially when it comes to the military, wouldn't commit to an investigation into what our reporting uncovered. But one agency is already looking into how the Defense Health Agency handles the discipline of doctors and providers who treat service members, the Government Accountability Office.
It's important for us to ensure that they are getting care that is from providers that are competent and qualified.
Sharon Silas is a director in the GAO's healthcare team. She oversaw a recent audit of the Defense Health Agency that looked at 55 discipline cases at just 4 military treatment facilities. It found military doctors in some cases were not being suspended as required while investigations were done. Notifications about suspensions to state medical boards and that confidential data bank were sometimes delayed for weeks or months beyond the required deadline. And some of the military facilities weren't notifying other hospitals or clinics about discipline at all, both in and outside the government system.
It's important for those healthcare systems to understand and know what types of concerns have been raised.
Their concerns often kept secret from military families.
And I do have to laugh. This thing is as broken as the system is.
Susie Way was given a box of ordinary things that sat on her son's nightstand the day he died. Ultimately, she never got what her family really wanted, justice for Jordan. The Ways submitted a malpractice claim with the military, along with expert testimony from physicians who reviewed his file. They concluded the doctors who treated Jordan were negligent in overprescribing and failing to evaluate him as he took more and more of the pills they ordered while his pain continued. The experts called his death avoidable, yet the family's claim and subsequent appeal were denied, along with nearly half of the claims submitted since the start of 2020.
If they can deny claims, if they can fail to pay people, if they can keep everything a secret, is there any incentive to do things better?
No. What? They hold all the cards. They hold all the cards. And they're not being, and the DOD is not being held responsible.
According to the Defense Health Agency, nearly 600 malpractice claims have been filed since January 2020. Only 20 of those have been paid. More than 250 have been denied. The rest sit in limbo. After the break, after years of reporting, we finally hear from the agency in an exclusive interview with its chief medical officer.
Welcome back to Investigate TV. After months of digging into military medical malpractice involving service members and their families, our team finally gets some answers. Josie Sturman is back with her interview of a top official with the agency that oversees military health care across the nation.
I commit to them, and our system commits to them, that we're doing everything we can to make the care safer and safer.
Dr. Paul Kortz is the Chief Medical Officer of the Defense Health Agency, the organization that oversees medical care for service members and their families. He's sitting down with our national investigative team for the first time following our years-long investigation, digging into medical malpractice in the military system.
My heart breaks for patients who have had complications and unintended outcomes as the result of our care.
Those unexpected and tragic outcomes have impacted the lives of thousands of service members and their families across the country.
This was him the morning of his surgery, and this is how they returned him to me. They failed him.
I know she didn't want to die. She had a family, she had kids, she had a husband.
But the DHA has been reluctant to answer wide-ranging questions about how mistakes, mishaps, and malpractice are handled, until now.
I think we've been very aggressive about being transparent.
Our investigations have found transparency is hard to come by, with people forced to fight to get information about how their loved ones were seriously hurt or killed in military facilities, and the identity of the providers involved withheld.
Our reporting has uncovered hundreds of reports about military physicians and medical providers made to a confidential data bank that tracks discipline, lawsuit settlements, and malpractice payments. Hundreds of suspensions and other disciplinary action taken against providers following mistakes or misconduct, and nearly $1 billion spent on malpractice claims filed against military doctors in the last 15 years.
Despite serious discipline and big dollars spent, the names of all those problematic providers are kept confidential by law. In the civilian world, that's not the case, with state medical board websites often listing discipline and malpractice payments. But in the military secretive system, patients are left in the dark.
If the goal is transparency, why not disclose doctors who have been disciplined?
Well, as I said, we follow federal regulations.
See, if they're outside the military system, they can look up whatever they want. If they're inside your circle, they can't do that. Does that feel right?
As a surgeon, what feels right to me is having a conversation with my patient. This piece about transparency is near and dear to my heart. Being transparent with the patients, we can certainly think through, not that more can't be done necessarily, but I think we've been very forthcoming with respect to the information that we have made available to the patients.
Courts pointed to agency and third-party websites that detail ratings, patient survey results, and statistics related to harm and deaths at specific military facilities and clinics. But we found the agency's Transparency Hub is hardly transparent, with no data found about adverse events at some locations and outdated news releases, reports, and policies on their homepage. The most recent post highlights high safety grades given to just 9 military hospitals, something courts cited during our interview, along with consistent recognition for a handful of facilities by the American College of Surgeons. But when pressed about the basic data we obtained about providers on the other end of the spectrum, those involved in discipline, he was far more elusive.
Is it satisfactory to you to have 500 doctors or providers reported in that small window of time?
Josie, we have multiple sources of information about the safety and quality of our care.
To you, does that seem like a low number? Is that a high number? What does that amount of reporting say about the quality of the military healthcare system?
We deliver excellent, safe, high-quality care.
Court says the goal is zero harm, something he says the DHA tries to achieve through root cause analysis, looking at what went wrong in serious injuries and deaths, using data to look for trends system-wide, and then creating policies designed to improve healthcare quality overall.
They deserve the highest quality, safest care that can be delivered anywhere in the world. And that's my commitment and our commitment to make that happen.
The Defense Health Agency says it supplies disciplinary action to that confidential government data bank and state medical boards as required, just like private hospitals, and that it's up to state boards to decide whether it's made public from there.
Up next, an unexpected diagnosis followed by lengthy surgery leads to a surprise bill of nearly $10,000. We explain how a federal law can help you wipe away surprise medical bills after the break. Welcome back to Investigate TV. If you have an emergency or sudden illness, you can't always control who is involved in your care. This could land you with what's known as a surprise medical bill, essentially the difference between the out-of-network provider's bill and the amount your health insurance paid. Cassidy Williams in Connecticut takes a look at a federal law that could potentially wipe away an unwanted bill, and hears from a mother whose daughter was hit with a nearly $10,000 surprise.
Navigating through the healthcare system can sometimes feel like making your way through a maze that doesn't post the rules, but there are resources to help you get a clearer picture to the exit.
Megan Lomasny was only a few months away from officially becoming a physician assistant when she got unexpected news.
She was diagnosed with a brain tumor. They think that she had this brain tumor for like 10 or 12 years, and she didn't know until it got to kind of a critical point.
Megan gave her mom Rita permission to share her story. In March 2022, Megan went through a 6.5-hour brain surgery. After a few months of recovery, she was able to graduate. She had just started her new job when in February 2023, they got another surprise, a bill for $9,422.
It was kind of like we had been through something horrible and now we were going through it again. So it brought back a lot of emotions too.
The bill was because someone in the operating room was considered out of network by her insurance company.
My daughter had no choice when she was unconscious on the operating table who worked on her, and she shouldn't have to pay for an out-of-network doctor under those circumstances.
Her instincts were right. If you choose the path of an in-network provider, you can't later be charged an out-of-network price. It's called the No Surprises Act. It's a federal law that went into effect at the start of 2022. It says insurers have to give you the in-network price if you didn't know ahead of time a provider was out of network.
Probably more often than not, if something doesn't look right, then it's not right.
Sean King is Connecticut's acting healthcare advocate. It's a state office that anyone in the state can call to get free help with health insurance questions and appeals.
We often refer to ourselves as the best kept secret in state government.
When the Lomasny's first appeal was denied by their insurance company, they called the Office of the Healthcare Advocate for help. The office was in the process of helping them file another appeal when Lomasny all of a sudden noticed a change in the bill statement online. It now says they owe nothing.
There's right and wrong, and in this case, it was obviously wrong.
The No Surprises Act is just one thing that can help you make your way through the healthcare maze. But with all the twists and turns, every trip will be different.
The Centers for Medicare and Medicaid Services has a No Surprises help desk that's accessible to anyone looking for a patient advocate to help them navigate the healthcare system. You can find that help desk at the link at the bottom of your screen. Coming up, according to the AARP, just 36% of adults who save for retirement expect to have enough money to be financially secure once they quit working. Tackling America's retirement crisis after the break. Welcome back to Investigate TV. A recent AARP survey finds 1 in 5 Americans over 50 have no retirement savings. Carice Jackman explores the ways you can start saving, even if it's just a few dollars at a time, in this week's Watching Your Wallet.
The AARP is calling it a retirement crisis.
We have far too many people who aren't prepared, to be perfectly blunt.
It's why David John, Senior Policy Advisor with the AARP, is trying to get the word out so people can prepare for retirement now.
We have about half the workforce who doesn't have access to a retirement savings program at work. We have most people who are saving don't feel that they have enough, and roughly 1 out of 5 people approaching retirement don't have anything saved whatsoever.
John says the AARP is hoping to turn the tide, both at state and federal levels. Congress is currently considering 2 pieces of legislation to expand retirement security: the Bipartisan Retirement Savings for Americans Act and the Automatic IRA Act, which would provide retirement savings accounts to eligible workers without employer-sponsored plans, something John believes will help Americans when it comes to post-work savings.
Workers who otherwise wouldn't have the opportunity to save for retirement at work can have the choice. If their employer decides, well, instead I'm going to open a 401k or something like that, that's great. If the employer doesn't, then the employer can put in the state auto IRA or a similar method. And this is low cost, doesn't cost the employer anything, simple, easy to understand, and it allows people who otherwise would just have Social Security to have a much more secure retirement future.
For those who may watch and listen to this and want to save for retirement, but they are living paycheck to paycheck, they say, I can't get this done. I'm just barely trying to make it through the week. David, what would your message be to them to encourage them they can do this?
So many people say, well, I can't do it. And what you can do is start small. I mean, especially if you're younger, you don't need to put in a huge amount of money to start off with. Start small, and then, as we've talked about, build up over time as you can afford it.
John also advises people to get a handle on what they're spending each month. Instead of eating out, maybe use that $30 towards saving for your retirement.
Because we sometimes are in automatic spending mode, and we don't really realize what we're focusing on and how much we're spending on things.
So look at your money and find ways to cut back. Remember, starting small with some retirement savings is better than no savings at all.
And that's it for us. Thanks for joining us here on Investigate TV. Hope to see you next week.